Welcome to CCED Seminars Clinical Series. Today's demonstration is...
I'm going to be discussing and demonstrating a chiropractic adjustment to the temporomandibular joint, to the TMJ. Disclaimer alert. This is an educational video for doctors of chiropractic and chiropractic students to improve their chiropractic adjusting technique. Please do not perform this technique unless you are a doctor of chiropractic or a chiropractic student. If you are a patient, please do not let anyone perform this technique on you unless they are a doctor of chiropractic or a chiropractic student. Patient is laying supine. Doctor is positioned at the head of the table. I am going to be adjusting the right hand side. So we're going to bring the neck into slight flexion. I am going to have the patient's head resting on my hand. So we are doing slight rotation to the opposite side and slight flexion of the cervical spine. I am going to contact the patient's mandible with the side of my hand, and we're going to distract along the jawline. So you're going from superior to inferior, and then the adjustment is going to be superior and inferior and slightly going across along the line of the joint. It's a very light adjustment. Okay, go ahead and take a big deep breath in and breathe out.